Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal-Sentinel.
Republican Representative Amy Loudenbeck of Clinton is seeking re-election in the 31st Assembly District. Representative, welcome back to WisconsinEye.
Thank you.
I have a question for all incumbents. Top priority if you're re-elected in the next session. Go.
Top priority if re-elected in the next session.
Yes, ma'am.
Is completing the transportation corridor along I-3990, which I think is well underway, and then continuing with a balanced budget and funding all priorities.
Well, let's talk about the impasse in the Capitol over how we pay for highways, bridges, maintenance, and construction.
Okay.
You've been a part of a lot of caucuses. Your caucus stepped forward with a plan, didn't go anywhere. Where do we go next?
Well, I think we have to continue to put options out there. As you know, I had an option last session that would have been a user fee on heavy trucks.
Yep. You still like it?
Well, I have a modified version
Okay.
that I will be happy to advocate for. It's more narrow, but it does have to do same principle. Oversized and overweight vehicles, we haven't raised those fees since 1981. I happen
1981?
Except in some very limited circumstances, correct.
Excuse me for interrupting. Go ahead.
Yes, that's okay. It is quite surprising, though. I happen to have a very heavily OSAL route in my district, so I've looked at this. The money doesn't also always go back to the roads where the routes are being used, but overall, similar to what we did with the hybrid and electric vehicles, I think that there are some users that are not necessarily paying their fair share. So this may be a way, even if it's not going to pay for all of transportation, to at least be able to leverage so that we don't have more debt service. So it's not a comprehensive solution, but it's again putting out another idea to help pay for either debt service or transportation infrastructure directly.
Is that part of a package that would include a gas tax upper, registration fee upper, and T-word tolling?
Well, tolling's, I mean, we've already, for 3990, it's already underway, so I don't know that it would necessarily be able to be applied. Yeah. Well, I voted for the study. We got rid of it. We already did a pretty major study. Okay. We know it would cost a lot to put in the infrastructure, and it would cost drivers. I mean, when I look back at the heavy trucks proposal that I put out, a lot of the companies that I met with, I said, would you rather have this or tolls? And they said, well, we'd rather have this, but we'd rather have the gas tax. They'd rather, I mean, tolls would be extremely expensive compared to a couple cents a mile on a heavy truck. As far as gas tax, again, not the best collection mechanism. A diesel differential maybe, registration fees maybe, but I think we need to, again, look at the users and look at how much we need to borrow and what we need to borrow for. So I'm all for the efficiencies. I'm all for evaluating what our priorities are, but I do know that whether it's state highway rehab or interstates or local roads and bridges, that there certainly seems to be an appetite for making sure that we're not deferring too much work to the future because we don't want to get more behind.
As a member of the Finance Committee, you've been a part of all these major issues discussion. Let's turn to health care.
Okay.
How do we preserve and maybe expand health care in the rural areas, Representative?
The rural areas. So I do have a couple ideas that I'm working on in my office. One is expanding the use of telemedicine and ensuring that there's reimbursement for that. Obviously, I did a bill last session on mobile integrated health that's mostly being implemented in rural fire departments, but the whole concept of right care, right place, right time, not using the emergency room, which is the most expensive mechanism. And then I have a direct primary care clinic in my district in Darien. It's a cash clinic, so people have the ability to go there and they have a fee schedule and just take care of their needs outside of insurance. So if you have a high deductible, that would be something that the old model of actually having a local doctor's office that is not in a network or anything else that you can just go to. So I think those things will make a difference. I also know in general for rural areas and across Wisconsin, we want to make it a great place for people to want to live and work and raise their families.
State government have a duty to recruit and retain doctors, nurses, other physicians? Is that state government's job?
Well, we support the universities that do the residencies. So I think public health is a state priority. I don't think it is our number one obligation, but I do think when we look at the demographics in Wisconsin, we look at the package that we just passed as far as marketing ourselves to other states, to our veterans, to millennials, to boomerangers from the UW. I think that we made a good investment doing that, because when you look at declining enrollment in schools, when you look at the workforce shortages, when you just look in general at the aging of Wisconsin, we want this to be a vibrant next generation going forward. And I think marketing ourselves and making ourselves more attractive is a good public policy.
As a member of finance, you're aware of the partnership state government and Delta Dental that subsidizes dental clinics in low-income areas. Should that remain a priority in the next MA budget?
We'll see what the results are. I think that that MA reimbursement, one other thing that I will bring up on MA reimbursement that I do think that we can do to assist is raise the rate of MA reimbursement for ambulance service providers. So this also ties into transportation. I've thought about this a lot. The pressure points on particularly local units of government are transportation and fire and EMS.
Yep.
While if your ambulance services are being reimbursed at below cost, you're using your regular budget dollars to subsidize unreimbursed MA expenses. And so the state can increase that reimbursement rate, leverage more federal dollars, and then backfill some of that gap in the budget so that it does free up more for whether it is EMS services or local roads, but again, to have a healthier population and to be able to provide those services, because that's another issue in rural areas is response times for EMS, the ability to recruit volunteers on their department. So I think that I have identified some key areas that we can address that will make a difference, that are not necessarily a package, but they're a part of a policy direction that I think we need to be looking at, because it's not always just more money for shared revenue, for example. Why don't we start paying for what the expectation is?
Last question on healthcare. AARP estimates that 578,000 Wisconsin residents are caregivers for maybe a family member or another loved one. And would you support a law or regulation that requires hospitals to recognize and work with family caregivers when that person that they're helping is hospitalized? Have you studied that AARP proposal enough?
No, for support or financial support?
No, just to have access to medical records and have access to the person, not financial support.
Okay. Well, I would first ask what part of medical power of attorney and other things aren't working, because I think DHS has really made it pretty user-friendly. I've used the services myself as far as getting your medical wishes in order. And then we've certainly put in a lot of funding towards the ADRCs. So I'd like to use the network that's already in place and not necessarily put another mandate on providers, but I haven't looked at the proposal in detail.
Okay, thank you. Local governments have been living with levy limits to control property taxes 13, 14 years. Some local government leaders say that hurts their ability to provide local services. Keep levy limits, loosen them, get rid of them?
So back to the MA reimbursement issue.
Yes.
I think we should look at those pressure points. I do think that the levy limits have been extremely helpful in getting all local units of government to really sharpen their pencils, which was part of what, we wanted to find if there was, find efficiencies, encourage local units of government to work together. I understand that their health insurance rates are going to increase. Well, hopefully, we may see that stabilizing a little bit soon, but I'm using that as an example. Same thing with utilities or just regular cost of living increases for their employees. So if they're absolutely flat, besides net new construction, that's going to be difficult. But again, finding cost savings, deciding whether or not certain services they're providing are critical. I'd see a little I think that state shared revenue, for one, needs to be revisited. I think that formula needs to be revisited. Janesville, that I represent part of, is very unfairly treated in that formula. So I wouldn't mind rebalancing maybe the revenue streams for the locals, but levy limits, I mean, people are really happy having had some relief from property tax increases. I'm right on the Illinois border. Illinois now, they're the highest property taxes in the country, I believe. And so we're getting people that are moving here because we have a better tax climate. So I don't know if levy limit increases that put more on the property tax bill are the best situation. I'd rather maybe see some additional shared revenue, or again, helping the state pay for some of those unreimbursed expenses.
Kimberly Clark has asked for Foxconn-like tax benefits and tax breaks. Now, on February 22nd, the Assembly voted to send that bill to the Senate. If the Senate tweaked that bill and sent it back, giving Kimberly Clark benefits, would you vote for it again?
I guess it depends on what the tweaks were. If the tweaks were making it more modest and more checks and balances, I'd certainly support it. If it, for some reason, made it more generous, that would be a little bit concerning, because I think we put a pretty generous package out there. I think we put it out there early enough so they knew that we were working in good faith, but I don't know all the dynamics of what is happening currently as far as what modifications we could make to the agreement that would be acceptable to all parties.
You've heard the Democratic criticism that if you approve Kimberly Clark tax breaks, every other corporation in Wisconsin is going to seek them. Any response to that?
Well, if you remember back in '08 when Janesville was leaving, or when GM was leaving Janesville, I mean, a group of stakeholders came together. The city of Beloit was a stakeholder. I mean, they were willing to put cash down to keep GM in, and besides, the technical college and the city and the county and the state, but the state was a small partner. But we weren't able to put in a package, and we also didn't get to keep we lost the jobs. So I think that it is a real situation, and when you look at an economic driver like General Motors, it took many, many years to come back from that. So I don't know if it is going to be the standard for every company, but for thousands of employees, you can't look back and say, well, what would have happened if the state would have stepped in with this big incentive package, and would that have been the best thing? Janesville's moved on. It's going to be okay. So I don't think that this should be the new standard for every company, but I do think that extraordinary circumstances like Foxconn, I think we can do some certain exceptions.
Current budget, as you know, provides a rather large increase in state aid for K-12. Do you think that a similar large increase will be needed in the next state budget if you're back on finance?
So again, I've thought about some specific things that I think we can do to get at some of the drivers, some of the pressure points at the school district level. So traditionally, we put the money into the general aids that go through the the school funding formula. Mm-hmm. The last couple of years, we've put some in categorical aids, which are evenly distributed amongst all schools. We had the study committee. I'm interested to see what they come up with. For me, I think one way that we can be fair to students and families and communities and all school districts would be to increase the reimbursement rate for the special ed students. So special needs students, their reimbursement rate, again, is much less than the actual cost of educating those students. So the school districts are using their everyday operational revenue to offset those costs, where if we actually paid, even if we started moving the needle to get to 100%, I don't think we can do it right away. I know that's a $600 million price tag, but I think if we make a good faith effort, again, we're not picking winners and losers, we're choosing to actually address an issue, a pressure point at the school district level. But it could be a couple $100 million, and if we put it all into that, and maybe some mental health and other things that schools could show need for, rather than just continuing to just add more to the top of the formula and that picks winners and losers.
The debate over the corrections budget, you know that 2 of our prisons were built in the 1800s. Do we need a new state prison?
Well, I look at capacity issues, and I look on finance at the beds that are available, and we look at the opioid crisis. I mean, I think that the geriatric prison idea is excellent. in my opinion, because you do have some senior citizens that are needing to still be incarcerated because a nursing home would not take them, because would you want your parent living next to someone that has a severe criminal record? So the nursing homes, the felony conviction, nursing home's not going to take them. So geriatric prison, I think, is a great idea. I think perhaps a rehab kind of a prison would be a good idea, and maybe something specialized with regards to workforce would be a good idea, rather than just these large general population facilities. Maybe take the opportunity to actually do something a little bit different that has to do with the populations that we're experiencing, and handle them that way.
Where are you with the debate on legalizing medical marijuana and recreational marijuana?
So I voted for the CBD oil bills. I think it's been really interesting, even just in the past year, how that has been part of the conversation as far as healthcare. Now, my understanding is that CBD oil still does not have the psychoactive drugs in it, but medical marijuana would. I think there is some room to look at CBD oil being maybe more accessible, or having more education with the healthcare community, as far as, because I think it's more of a self, I don't think doctors are necessarily prescribing CBD oil for all patients. I think for seizure disorders and some of those things, yes. But for other things, I think people are using it, are kind of self-medicating. So if we can make that connection, I think that there's some still room in CBD oil without medical marijuana. We can look at what other states are doing with regards to recreational marijuana. I can tell you I am not in favor of anything like what Colorado has done. I don't think that's the right direction for our state. If communities want to work on decriminalizing or lower fines so that we're not filling up our prisons with possession offenses, I don't have a problem with that, but I don't see opening up the door completely on recreational. Okay. And medical, I'd like to see what room we have to grow with CBD.
Finally, you want to highlight differences between you and your Republican opponent on November 6th.
Okay, so I had the privilege of being elected in 2010. It's 2018 now. I think Wisconsin is heading in the right direction. My opponent has stated Wisconsin is clearly heading in the wrong direction. We fundamentally disagree on that. I think that if I look back, particularly at Beloit and the area and Janesville, those areas of Rock County, and even beyond, Walworth County, when we had the recession in 2008, manufacturing and tourism took a big hit. 08, 09, it took several years to grow ourselves out of that. This administration has invested a lot in tourism. We have a great secretary. Tourism is doing really well in Walworth County and in Rock County. Manufacturing has picked up. We've had a lot of great investments and partnerships with the state. We've had a lot of great private investment as well. So now I'm not knocking on doors that have foreclosure signs in front of them. I'm trying to figure out what's new construction and if it's on my voting list. So I think that we're doing really well. I think agriculture, in 2010, agriculture was kind of carrying a little bit of the load for the other industries that weren't doing so well. Now we're seeing a dip there. There's always more to do. I'm not saying that it's perfect for everyone, but I definitely think we're on the right track, and I think I've been a part of that, and I want to continue, and I have a lot of great experience, especially with the Finance Committee, that I think I can bring to the table and be a resource and an advocate for the district and continue these good policies and keep making Wisconsin better.
Republican Representative Amy Loudenbeck of Clinton is seeking re-election in the 31st Assembly District. The election is November 6th. Representative, thank you for visiting with WisconsinEye.
Thank you very much.
Thank you.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal-Sentinel.